Welcome, everybody. I am Sarah Chavez, and I am one of the owners here at Cocoa Vida. And we have Dr. Filner, who is the Chief Medical Advisor for Microlight Corporation and an expert at trigger point therapy. Was an anesthesiologist for 40 years, Dr. Filner, plus. And so, very knowledgeable. We're very grateful to have you here with us. And today, we're going to be talking about part two of continuing on about back pain. And I know a lot of people suffer from back pain, and I've been lasering a lot of people here in my town, and so been seeing those types of issues. So if somebody is suffering from back pain, Dr. Filner, what would you be your suggestion with the laser?
Well, first of all, it's the most common reason people go to see a doctor is back pain.
Ah,
And it's probably involves at least about uh, 60 or 70 million people in this country. Uh,
goodness.
First of all, I think one of the things I could show here is what I showed you in the past is this book by Dr. Beal, where it says the trail guide to the body's quick reference to stretch and strengthen. Stretching is ultimately what resolves any trigger point problem. The idea is to shut off the pain from the trigger point and let the muscles relax. And then, after using some heat, do the appropriate stretch, which is ultimately the treatment for these problems. Uh, Volume one of this series by Dr. Beal has a quick reference to trigger points, and it shows all of the trigger points that are commonly seen in the upper back, the neck, the upper back, the lower back, the mid back, and the legs. So it's anybody who is wanting to treat trigger points in individuals should have some recognition of where they are and where to treat.
Right.
And though that series can be purchased on Amazon, I think they're about $9 a piece, something like that.
Right. So fairly inexpensive. So this
Hmm.
could be used if you have a laser at home, because this laser is different from other lasers where, the average person could have it in their home, correct?
Yeah, this laser is another name for it is low power laser because the in addition to the wavelength being appropriate, the power in terms of milliwatts will keep it from creating heat at the depth that it goes, as well as allowing it to treat uh, the muscles where the circulation has decreased because of the tightness from the trigger points, and it will cause these small blood vessels to release nitric oxide, which is a vasodilator, and will increase blood flow into that area and let the muscle relax, as well as get rid of a number of the things that have collected in the muscle while it was tight. And the other thing that it does is that it will decrease the C fiber, which is the main nerve supply of those small blood vessels and muscles that will carry pain impulses to the brain. And the laser will tend to diminish that, which is one of the reasons you not only see an increase in circulation, but you'll see uh, a decrease in the pain that the patient is or the individual is feeling. So the difference is that the microlight laser is a class 3B laser, and the limitations on it have mostly to do with the power of the laser. The class 4 lasers, which are the lasers that are used in surgical procedures, will vaporize tissue. So
That's
they
scary.
they will cut and they will vaporize. So obviously you can't use that in treating trigger points.
Right. That doesn't work.
Uh, and as far as I'm aware, the smart laser 830 nanometer one is the only one that's strong enough to treat trigger points, but not too strong to cause heat and uh, tissue destruction.
Right.
And a number of the competitors at different wavelengths and different powers are, in fact, like laser pointers or the scanners in a grocery store, things like that, where they would not be very effective in treating trigger points. So that it's really important to know to get the information on any unit that someone is trying to sell you.
Right.
Now, in
Because
terms of back pain, clearly one of the things that uh, actually Mike Barber's trying to call me now.
oh, okay.
I think he will be trying to come on soon.
Okay, that's fine.
But in case the paraspinous muscles sort of follow along from the neck down to mid thoracic area, and then there's some that are slightly above that and go down in sheaths. Usually there are about three that go from the neck down to the tailbone. And they may have trigger points in them, which can give you some back pain. One of the things that's important is to understand if you go to an orthopedic surgeon or a neurosurgeon or even a neurologist, the likelihood is number one, you have to be very specific about what your symptoms are. Do not say numb if you have feeling, because numb means zero feeling. And if you say something is numb, your symptoms will be put into a pigeonhole, and all the rest of the treatments and diagnostic tests will flow from that.
Okay.
And also, it's important to know that when a neurologic exam is done on you after you present yourself to the practitioner, if that is normal, an MRI scan is not going to demonstrate anything abnormal. Statistically, it's extremely rare for an MRI scan to show anything in a patient with a normal neurologic exam, a completely normal neurologic exam. So you can imagine how much money and healthcare costs is spent as part of a diagnostic evaluation. Most of the time, if you see an orthopedic surgeon or a neurosurgeon, the first thing they'll do is suggest bed rest for a short period of time, usually about a week or 10 days. If that with mild analgesics like Tylenol doesn't resolve the problem, then it's not uncommon to send you to a physical therapist. If the physical therapist doesn't do only stretching, if they try to strengthen you, you're going to get worse.
Right.
Because if the trigger points are there and strengthening exercises are attempted, it will aggravate the problem. So that's one of the reasons people tend to switch therapists frequently, is because the majority of physical therapists don't understand that the trigger points need to be stretched as opposed to have the muscle strengthened. A lot of physical therapists will work on your abdominal muscles in an attempt to relieve back pain, because if those abdominal muscles are stronger, they will relieve some of the stress on the back muscles. But it won't change anything as far as trigger points are concerned. The next areas to look at are muscles called the iliocostalis, which means the muscle goes from the ilium, which is the top of the pelvic crest, up to the bottom ribs.
Okay.
That's what costalis means. That muscle will refer down into the gluteal area in the buttocks, as well as towards the hip, and will cause significant back pain. Uh, the associated muscles cause the called the quadratus lumborum is a muscle that's primarily concerned with twisting. And if you know any golfers who spend a lot of time uh, on the golfing range twisting their body, that's inevitably the muscle that gets involved when they have back pain. And it almost reproduces an L4-5 disc problem. So they often end up having a surgical procedure that was unnecessary. And the pain doesn't go away. I suspect that Tiger Woods has had that problem. And probably had he been treated by someone who understood what trigger points will do, then he might have avoided some of the surgeries that he's had and might have been continuing to play golf.
That's a great
Another,
point, Dr. Filner. I want to ask you, most people, I hear a lot of people say, well, you know, with helping people with the laser. Well, my doctor said I might need surgery. And I'm like, okay, do you feel a lot of times maybe surgery happens unnecessarily because they are unaware? Maybe they have trigger points or that something else is
it's very common.
okay. Yeah.
Unnecessary surgery is very common.
Yeah. I thought you were gonna say that.
And if a good neurologic exam is done, the MRI scan will show no pathology. So will make it very unlikely that the surgeon will intervene. Uh, and I can tell you from my own experience when I was working in the hospital, were a number of neurosurgeons and orthopedic surgeons who asked me to see a patient because they still had pain after their surgery. And invariably, they had trigger points that I injected with lidocaine, and their pain went away. So they didn't need a second surgery, which is what the surgeon wants to do, thinking that they left something behind and they need a second surgery. So don't let the surgeons push you into a second surgery if the first one hasn't worked.
Okay.
So it's the system that we have, the medical system, is not geared towards finding problems. There are very few, especially surgeons and neurologists, who have ever understood what a trigger point is, let alone how to deal with it. And frequently, if you ask one of these people about the laser, they'll say, "Oh, it can't work." And then you should ask them, "Have you ever used it?"
Right.
Most of them will say, "No, they've never used it," and they just can't believe, which was my original thought when I heard about the laser in 2004. I didn't expect it to be useful
Right.
until I tested it 2 weeks later and it worked. And within a year, I had stopped doing injections and went entirely to using the laser to inactivate trigger points.
Right, because you used to do the dry needling with needles.
No, I've never done dry needling because it tends to be very uncomfortable
Okay.
and is not as effective. I always used a small amount of local anesthetic and a small needle.
Okay.
Uh, and I can tell you in my first 15 years of pain practice, I did uh, about 600,000, excuse me, I did 600,000 trigger point injections. When
Wow.
I got to know about the laser after about a year, I started using that exclusively, and I've inactivated more than 400,000 trigger points with it.
That's
So I've
remarkable.
probably seen over 1 million trigger points that I've inactivated, and I've consulted on even more. So the key is understanding what these problems are, where
Mhm.
to look for them, and then how to ultimately treat it. And one of the things that we've discovered is by using a few drops of CBD on the skin before you use the laser actually makes it more effective, uh,
Right.
and it works more completely. Uh, and I've been able to inactivate trigger points with a single uh, treatment using CBD.
So that the laser drives that down into the tissue, is that correct?
It acts as an iontophoretic idea where instead of electrical activity, you're using the light, which is on the electromagnetic spectrum, and that pushes the CBD into the tissues because the tissues have changed once the laser causes the increase in circulation. So it's basically the same uh, electrical activity that when people used to do iontophoresis, there were chiropractors and physical therapists who weren't allowed to do injections by their license. So
Okay.
they would use iontophoresis to push a drug like a steroid into the tissues. And using CBD with the laser, in effect, duplicates uh, that electrical activity. So we're able to actually improve the response uh, to using trigger points. One of the other things I might mention that I did mention last time was that a lot of people who have what they call low back pain is actually sciatica. And the vast majority of sciatica does not come from the low back. It comes from uh, entrapment of the sciatic nerve by the piriformis muscle. Piriformis muscle in the gluteal area is the primary external rotator of the hip. And there are trigger points at the sacral attachment and at the sacrum, and another trigger point where the attachment is on the femur, which acts as the external rotator. And you can diagnose this by having a patient lie on their back and see what happens with their foot. If their foot rotates out when they're relaxed, their piriformis muscle is tight, and the sciatic nerve will either go above, below, or through the piriformis muscle. So that by inactivating the trigger points in the piriformis muscle, you can treat the sciatica. Uh, and you could have symptoms from the sciatica all the way down to your foot. Uh, so you might need a number of treatments before that entrapment is relieved. And it's one of the significant entrapments you find where a tight muscle will entrap uh, a nerve or a bunch of nerves
Right.
and give you symptoms.
Okay. Okay, that's good to know. This is it's a miracle to see what the laser does, Dr. Filner. Just working with the people here in town and seeing the before and after. It's
Can you speak a little louder?
yes, I was just saying it's just a wonderful. The laser's wonderful, and to see the reaction of people before and after because they look at this and they're like, "How's this going to help me?" And then they feel relief from it, and it's really incredible that we have the availability. You don't even have to go to the doctor. You can have one right in your home to use for your own family.
Yeah, and once people see that there's no risk and no pain associated with the treatment, they are very interested.
Yes, I would agree with that, and I feel blessed to have a laser and to be able to help other people with treatments and to gain knowledge from you. Thank you for this call today. I really appreciate it. It's been amazing.
Yeah, that's what my interest is after I retired from my practice is to spread the word uh, and increase the utilization of the laser for all sorts of pain.
Yes, I think we need to have one in every home. Thank you, Dr. Filner, for your call today. I appreciate it.